Welcome to the OHBPOV podcast. Russ McGibney, Sean Dennis. I'm about to be surprised with our new topic for this week.
Well, normally I try to keep us a little on this, but yeah, that one's out for today because I know the subject is something near and dear to Sean's heart. So,
What do we got?
health care in the United States.
Oh my gosh. Yeah.
And is considering how your arm is right there, you've utilized the health care locally, not real locally, but just quite a bit. So, so let me.
Yeah, I'm gonna sound like a hypocrite all day today because I come down on both sides of this. I don't. It's how to fix this is beyond me, but I'm interested to see where we're headed.
Well, let me. This is an AI overview. So, Google Gemini. In the U.S., healthcare is controlled by a combination of the federal and state governments, which that sort of surprised me that AI would say that. Now, it does say to, always check the stats on
Yeah,
AI.
why is that? How
Yeah.
would that be true?
Yeah, I'm not so sure. With the federal government primarily responsible for establishing policies and regulations, I can see some of that. While the United States have significant autonomy, while the states, have significant autonomy in implementing and enforcing these policies, the U.S. Department of Health and Human Services plays a key role at all federal level, overseeing various agencies like Food and Drug and Centers for Medical and Medical Services. States also have their own healthcare agencies and regulations, often aligned with federal guidelines. So
RFK Jr. is in charge of this right now, then?
well, he is in charge of
HHS?
HHS, yes.
That's what you just said.
So the regulatory system and things. Now, you previously have said to me the issue that you fear that if not all, most healthcare systems, you claim one locally to be a socialist entity.
KCH is a socialist entity. It's not hard to figure out. I mean, 8th grade education will help you get there.
Well, but based on just what that says, that they have to abide by all these, government rules and regulations.
So do the immigrants. Anybody abiding by any of those rules or regulations?
No,
You get my point. You think? Do you think anybody?
Now, granted, no, wait a minute. We'll just pause on that. I'm sure.
When's the last indictment you've heard of from somebody not following a rule or regulation? What's that? That Sizzle kid that went to prison for charging $10,000 a pill? That's the last thing I can remember.
Well, there's been many, Medicare fraud, Medicaid. I mean, just locally here, you had the person who was in charge of Riverside Recovery be, embezzling a bunch of money and based on Medicaid fraud.
Is that why they closed out here?
Yeah.
And who was that?
I think her last name was Smart.
Apparently not very.
I thought the same thing. And this was not her first time. This was her actually at least second, maybe third.
Riverside Recovery, that's not their first time either. So this was just a branch. How did they give somebody like her that kind of power if it wasn't her first time?
And why? I mean,
that makes sense because I've heard some scuttlebutt about some people having problems who are utilizing Riverside Recovery where they owed a bunch of money that went to Riverside Recovery and didn't make it to them. This is starting to ring a bell. I saw it closed. I didn't even understand this was.
It's if you have nefarious ideology, you can, and play the short game. You can get into stuff like this because, well, hopefully Doge will, and I see the protesters have not. Beautiful sunny day, and they must all be mowing their yard because they're not on the square. Schmidt's sausage truck is on the square to help, provide.
Was there something planned for today?
Well, I don't know, but I know they were there yesterday.
Doing what for what?
Down with Doge and hands off our, everything.
Okay, so not the health care, just
hands off Medicare, hands off our Social Security. So. But now we'll go back to this. Let's see. Various organizations and actors also play a role in shaping healthcare policy, including private insurance, healthcare providers, and advocacy groups. It's one of those things. Somebody sets up the rules, and you have to play by them.
What are all these rules you're talking? What is it that you're even referring to? What rules and regulations other than cost?
Well,
and that's probably limited. But other than that, what are the rules and regulations? Because last I remember, I think our government was not only allowing but funding illegal shit in China that got loose and out of hand. So it doesn't seem to me like there's a lot of rules and regulations that have a real impact on. You're making it sound like our federal and state governments got control of it and have control all these companies. I don't think so.
Well, see, that's the thing.
In fact, they're probably subsidizing them.
I've said for a number of years, lobbyists should only have access to an elected official right there before God and Country on C-SPAN.
When did lobbyists get invented?
Well,
there shouldn't be any lobbyists, period. That's called a con man. That's called a middleman. That's called somebody to pay to get what you need without actually going right directly to the...
it also can be called an arm breaker because, all a lobbyist has to do is get a little, salacious information on a congressman or senator or whoever is in, the regulatory agencies making up the rules, and just, influence them to do their will.
That's why they shouldn't exist to begin with.
Exactly.
Okay, so we're arguing the same point.
Mm-hmm.
What's that have to do with health care?
Well,
controlling the regulations, I don't think that's the problem. Here's the crux of the problem. Tell me if I'm wrong.
Okay.
Just go to the base of it. You either need to have the ability for a capitalist business structure to allow a doctor or a research firm or a diagnostic firm, let them do whatever they want and let them make however much money they can make in order to give the best health care in the world. That's why Arabs have a floor at the Cleveland Clinic up in Cleveland. Everybody comes to the United States, and a surgeon ought to be able to charge whatever the market will bear him to charge. Okay, when you start creating these environments where you don't allow the capitalist structure in healthcare, who's going to go out on a limb and invest all the money and time in research and development to cure the next disease, to find the next cure that they do discover? Nobody, because there's nothing in it for them. Nobody's going to risk that. Nobody's going to invest the time and money because they don't have a big come at the end that the capitalist structure gives them. Not to mention that if the government's in control and I want the best surgeon for my shoulder, well, you don't get the best. You get whatever the government provides you.
Right.
You don't get a selection. You don't get, and even if you did, which they don't, but even if you did, how would you know what the best was? Because they're all getting paid the same thing for the same service, for the same. If you want to excel in an area, you have to let the money be the carrot and dictate. I don't think you're talking about the other end of things, not the incentives. You're talking about punishments with rules and regulations. I just
True.
don't think that has anything to do with solving our problem with healthcare. I don't know how you allow. I don't know how to do it. I mean, I don't know how to allow the best surgeons to charge the most money because they're the best at what they do, and at the same time allow people who don't have the wherewithal to pay for health to be able to have any freaking surgeon sometimes, let alone the best.
Right.
So there's got to be a way to do it. I'm just not smart enough to know how that is. I mean, all I've witnessed over the years is people figuring out how to use the system, and sometimes I understand, sometimes I get it. You know what I mean? Because their option is even worse than that rule they're taking and playing the system. So, and the government spends so much money. It just seems like if the government if we could get in the middle together somewhere, and there wasn't so much corruption, and maybe increase Medicaid to a larger number of people, maybe anybody that makes less than 100 grand a year or 200 grand a year or whatever that number is growing to be nowadays, but just allow them to be taken care of, and then let the capitalist structure exist, and the people who want to get outside that have the ability to get outside that, then let them pay for their own thing. But I don't know how that would work, and I don't even know that that's feasible.
Well,
But am I right? Is that not the linchpin? Is that not the main? We either want a country to have the best doctors in the world where everybody wants to go, or we have a government-controlled, regulated set of doctors that is...
Well, at that point, there's, like right now, the incentive, sadly, well, let me get back to what I was going to say. You have this almost incestuous menage a trois of, government, the healthcare system, hospitals, doctors, and so forth, and the insurance. It's one over the other. It's just ugly because the only person who doesn't get a smile on their face at the end is us.
Yeah.
When we
agreed, and I hate insurance. Not a fan of insurance. And we are all taught early on in life to self-insure and spend the same amount of money and put it into a program where we build something that if we don't use, we don't need a claim, or we don't have need a backup, then we have our money sitting right there that basically has been a benefit to us, not an insurance company. But for whatever reason, we're not given those set of skills when we're young and taught those kind of things.
Well, and it used to be there was several different kinds of nonprofit, health or insurance. Blue Cross Blue Shield was the last, bastion of nonprofit, and typically in a nonprofit atmosphere, depending on how you run things, a nonprofit is not going to charge excessive amounts of money because they don't,
Nonprofit just means at the end they can't have a profit at the end of the year.
True. The president can make more money, and
nothing really. Okay.
Well,
you
Blue Cross Blue Shield was more of a Christian-based, healthcare, and there are a few of those out there still that are Christian-based. You pay into them. There's a famous one that unfortunately escapes my lips right now, but they've been around for over 30 years, and you pay monthly premium to them. And
what's this Bible share one?
Yeah, it's
that what you're talking about?
Yeah, and
I don't know how it works. I have no idea how it works. The bottom line is it's a disaster. I mean, across the board. If you aren't smart enough to know how to work the game to get what a person needs, you just do without. I just don't think that's. I mean, in our country, this is the last part of my critical eye. I mean, there's a lot of areas could be improved, but this is the last major thing that I thought in my lifetime would have been figured out or allowed the American citizen. I think the health care probably should be more important than even Social Security because, Social Security's them just basically being mom and dad and invested our money for us. But the health care, I think, should have been dealt with before. And maybe because it's so difficult, that's why it hasn't.
Well, we'll jump here to arguments for health care as a right. So, social justice and equity.
And forget all that, but healthcare is a right. It's
that's
interesting.
why I was going through.
Fuck social justice. I mean, it has nothing to do with it.
That's the point of this kind of argument for it.
Yeah, okay.
Healthcare access is crucial for a healthy and productive society, and denying it to certain groups creates social inequalities.
Yeah, that's what I'm talking about. I don't even know what all social justice, social inequalities. I just don't. I don't even. I don't understand. I don't see it because I just don't see the world the way these people think that I do or we do.
You've made that point in a couple of your statements. One, you said the Arabs have an entire floor at the Cleveland Clinic.
Just something I happen to have learned from my experiences at the Cleveland Clinic. So, they have a whole floor.
Well, that's so that and how the fact that people come here to the United States to pay for, so people of means have access to better health care. People.
That was what I was trying to say earlier. I mean, you put it in a nutshell for me. I agree. Yeah, I mean, that's unfortunately that's where we are. But without the capitalist structure applied to healthcare, I don't know how you get Tom Brady's in the medical field. I don't know how you get.
True, but
who's going to motivate anybody to give a shit? Who's going to go out and play football for making the same amount of money that a guy?
Well, that's another subject.
Well, but you understand what I'm saying. You've got to be able to motivate the healthcare system in a way to have new cures, new discoveries, better surgeries, better treatments.
Right.
The computerized stuff that's taken over now. Does our government want to try to be in the business of buying all that shit? And then, no, they need to let people who know what they're doing buy and invest in all that. But there's got to be an overlap. I said at the beginning I'm going to contradict myself the whole show. I knew I would. I'm being hypocritical because I don't know the answer.
Well, it's
and then I am passionate about it.
Yeah. I mean. So let's see. Basic benefits, investing in public health and preventive care can lead to long-term cost savings by reducing the burden of chronic diseases. Now, that said, I think the primary care, which we would always say a GP, general practitioner, that is very underutilized. I mean, growing up, we knew maybe a dozen primary care physicians in Mount Vernon. Now all I could ever think of, is maybe 4 or 5, and one of them has just been taken off the list right now. Unfortunately, Dr. Carroll is going through. You haven't heard that one?
Go through what?
Well, some very bad accusatory allegations of inappropriate things toward a patient. I hope this gets cleared out. I mean, it has been stated that this person is bipolar and has some severe mental
Yeah, I'll take
challenges, but
let the
Yep.
authorities figure it out. But I
So-
don't. I'm not sure I'm following you. A general practitioner. What's that have to do with what?
well, just what
are
I
you
said
trying
here. Invest in public health and preventive care. So that's a GP. The more we're able to access it, and that can be a teledoc situation.
Okay, there you go. You said it right there. What couldn't the system become just a just an opinion guy using some math? You know what I mean? I don't know anything about the medical industry, but couldn't it be streamlined with this teledoc stuff? I mean, the brick and mortar and people coming and sitting in lobbies that are already sick to begin with, around each other to begin with, so that they can charge more, and then you're paying for the rental of the brick and mortar. Why can't we just accept? And I think this new generation, one of the compliments I would give the Gen Zers is that, and of course they don't need medical stuff right now that much because of their age, but they don't really participate in health insurance and going to see a doctor or having a doctor. There's a lot, like you were talking about, kind of the trend of using the non-medical medicines, treatments, different things like that has actually made a very credible, legitimate growth from what I'm seeing and learning.
Well,
So why can't it get streamlined and cut the costs dramatically so that everybody can get the treatment they need without making it more difficult?
just exactly
Or banning them from whole campuses and stuff.
the whole thing comes down to who wants to give up their dollar, and nobody wants to do that. So teledoc, is a efficient, easy way to see somebody. I think
Isn't that a way for the insurance companies to actually play a positive role instead of the negative role that they seem to have, especially in our country now? Can't the insurance companies go in there and go, we're not paying for this anymore, we're requiring teledoc stuff? If you
I
want to
suppose
buy
so.
our health insurance,
right.
your first 6 visits for whatever have to be by Well, that'd be to the better interest of the patient anyway.
Well, true.
And if that's what their insurance requires, the doctors have to figure out how to. We have to check with your insurance. Have to make sure you get. So if that's what the insurance controls and regulates, why can't they step up and do something positive?
And that sounds very
Does
good.
that come back to Congress to
I
make them
would
do
hope
that?
not.
Probably. I mean,
And where that,
but why wouldn't it be in the insurance company's best interest? Wouldn't you think?
I would think so.
Till they got sued for saying, if I'd have come in, they'd have saw the growth on my neck or whatever.
Well, that's you have that too. I think there probably is at least one time a year you should be seen, by an actual physician.
Yeah, you can't get a shoulder snap back into place over a video. So
No.
I'm not suggesting you don't need emergency rooms in hospitals. I'm talking about the brick and mortar doctor's office with the prestige and all that. Rite of passage that was created as a doctor to charge so much money. I think everything the system makes you feel like you have to go somewhere and see their diploma on the wall and see their employees, and you're just paying for all that shit.
Yeah. Well, a lot of that too is just the issues. You got the healthcare that interfere. Well, the doctors have such high. That's why so many doctors go under the umbrella of the Nimith was, I think, the last holdout around here to go under the umbrella of the hospital.
You mean under the socialist bubble?
Okay.
Well, they pay everybody. They control, and none of those doctors have their own insurance.
But that's
none of
the
those
main
doctors.
thing.
It's not
Insurance.
I don't know if it's the main thing, but it's
Well,
certainly.
how much has your insurance gone up? In the last year.
Well, I mean, I think all the insurance is going up for everybody. I don't know why you're asking me. I mean, not dramatically.
Well,
For mine.
my home used to be Yeah, I guess it's only gone up maybe $10. $125 a month, and now it's $135. My car's gone up.
These are real fucking numbers. These are real. You know what I mean? That's petty compared to the health insurance kind of numbers we're talking about. Talking about something going up $10. I mean, we're talking about people getting tens of thousands of dollars a treatment.
Oh, I know.
You know what I mean? Like they sit there for 3 hours and get some special blood, and it's 13 grand.
Yes.
Well, and they paid for people they never saw, and if you actually got the bill and looked at it and read any of that stuff, which nobody does, if they did, it would blow your mind what you're actually paying for.
Well, if you could understand it.
I didn't get that. I only saw one person the whole day I was there. I'm being charged for 6.
And that's some of what Riverside Recovery, they claim that they saw a client. And
corruption in any business, and that'll all be attended to. But the corruption, I'm sure. Well, I mean, we're not even bringing up the obvious before the show gets over. I think it's sick. These people that are donating all this money to this kid that shot this other guy because he works for an insurance company.
Oh, yeah.
I don't like insurance companies any more than anybody else, but nobody deserves to die over it.
Right.
Nobody.
Right.
Period.
Exactly.
Okay. I mean, you'd have to go to we won't go down the line of pedophiles and different things that might change my mind as to where that would fall. But working for an insurance company certainly is not to the level that justifies that.
Right.
So that's sick. But despite those sick people, it's like $1 million almost now. I mean, it's sick.
Oh, well, I thought it was well over $1 million.
No, it was like just under $1 million last I heard. But anyway, the point is that we've got these little cells of people in our country right now, and I don't agree with this approach. Clearly, I think it's crazy. I think it's sick. I think it's nuts. However, I am happy that we're having more dialogue, more discussions about the healthcare industry and what's going on. So when you bring up corruption, that's just an automatic. That needs to go, just like all the other corruption and everything else. I just think it needs to be, what was the word that the Democrats used? Like, it just made my brain squash. I've been trying to remember. We've got to not reinvent, but reimagine.
Reimagine. Oh, okay.
We've got to reimagine. Can we use it too? I'm not a
I'm
Democrat. I'm not
that.
a Republican. I'm just an independent in the middle. Am I allowed to say?
Absolutely.
That sounds kind of corny, but honestly, I mean, in good faith, in my lifetime, I think it would be incredible if we could reimagine the health industry in a way like we're reimagining Department of Education, some different stuff like that.
Well, there's a lot of legitimacy to that because, again, you have to probably healthcare, through that triangle that I mentioned.
Which is way too complicated for me. It's true. I agree with it. But, man, the corruption in that circle, that's
the money wasted trying to prop up each leg of that triangle is, as much that could, we could probably each person in the United States could probably, have $1 million in their bank account for all the money that's spent on the corrupt part of healthcare through the government, making regulations based on what somebody else wanted.
That's just a redundant. I mean, we got to try to make a bigger splash than talking about that because that's obvious. And I don't know how you ever change it, but I liked what you said earlier. And again, people might be surprised to know me, but I wonder if there isn't health care as a right to some degree. For American citizens, tax-paying citizens, right. Okay? Mm-hmm. They're going to collect our taxes. If we're going to participate and we're the shareholders of this country, this business, it's honestly, it's the first time I've really seen it like this, but it makes sense. Our country arguably is being run more like a business right now,
Right.
which
Yeah,
some
yes.
argue that it should have in the past. Okay. Well, again, if you owned a business and you had employees that worked for you who were paying taxes and you were paying them income, did they have a right to health insurance? Do you see what I'm saying?
Yes.
So if we're to a point where companies at certain levels are obligated or need to be obligated based on something to provide some health care for their employees for that company to be credible, doesn't that fit with we're managing our country, the United States of America, now like a business? Shouldn't the taxpayers, the employees of that company, deserve some level of health coverage?
Now, funny you say that, because some people in the United States do. Those people who are on Medicare and Medicaid. Medicare and Medicaid.
Medicaid's something that's been paid into at least.
Right.
Okay. Medicaid is not.
Now, well, unless,
very different customer base.
But unless those people have paid into the tax base, if they paid into the tax base, then Medicare, Medicaid is
most people on Medicaid. Not all. Most people on Medicaid aren't paying in shit. That's why they're on Medicaid. Okay.
Sometimes that comes around based on
I would say
situations.
It's a small minority of the cases of people on Medicaid are people who've been paying into the system and all of a sudden fell on hard times and their unemployment ran out and now they have zero income.
But
maybe
it does happen. Yeah.
I didn't say it doesn't.
Okay.
I think it's a small element of the people who are on Medicaid.
Okay. That's fine. You go along with
So
that,
I mean, they need to be looked at differently. Is all I'm saying. Both need to be looked at.
Right.
And Medicare, but I don't think Medicare's. I mean, Medicare's more of an earned, like Social Security to me.
Right.
Okay.
Because you have paid into it. So
right.
You
the Medicaid, if it was a requirement that people had paid into the fund, a fund into our country for a long enough period of time that if you did fall on hard times, then it applied. Sure. I mean, I think we just give money to people because of the bleeding heart of they can't let them starve. And I mean, since we're feeding people and everywhere in the world now, I mean, it's hard to argue we shouldn't at least be feeding our own. It's just the caliber, the quality of the program.
Right.
In my opinion. So, I mean, I think there's a ton of things. But I would argue, solve that problem completely from what we talked about today and say everybody who makes less than $100,000 a year gets Medicaid. Period.
Well, but where's that money come from?
Well, same place everything else we spend money on comes from. From our taxes. This is not about... It's not about whether this should be dealt with. I think the health system finally needs to be dealt with. I'm not sure how it would work. I'm not saying that's the number. Maybe it's 200,000 and under the way, housing costs are where they're at right now. 100 grand might not be enough. But that solves all the problems because then you're not differentiating. Then you're not being selective of who you're helping. You're not helping somebody who's a baby mama of 4 kids from 3 different dads who just chooses not to make an effort to work. You're not choosing
there's life choices.
You're not choosing to give people who aren't trying to make their life any better over people who are trying to make their life better, and because they made $100 because they made $51,000 last year, they don't qualify. In 51, I mean, what'd that do? Feed their pet? You know what I mean? So I mean, take the selective application of the program out. Take the corruption out. Take the angst out of, I don't think she deserves my tax money or he deserves my tax money any more than me. I'm at least working. Take all that out. Get rid of all that animosity. If you don't make $100,000 in a year, your health care's taken care of by our government if you're an American citizen. That's what you get for being an American citizen. I mean, there's going to be certain elements of being a member of our club ought to have its benefits.
Well, true, and
you shouldn't have to justify everything. Sometimes maybe we just deserve some stuff. Healthcare, I think, should be moved.
Well, that's
to the top, even above retirement.
Well,
if you don't have your health, what good's your retirement?
Well, true.
And honestly, the quicker you die, the better it is on their economic break of the retirement.
That's what Social Security was imagined as. That fund would go forever because people would die at 67, 68.
Yeah.
And,
there's every motivation in the world for them to not fix this. But it's the right thing to do. I think somebody needs to say it.
Well, but now, look in the other direction of things. You've got all this money. Now, if we start collecting the money, and where does that, do we add an extra tax on for this?
Yeah, I don't know how you fund any of this shit. I mean, somebody way smarter than me got to get involved with federal budget. And not only that, but I think there's so much pork and so much crap and so much corruption that if any of us normal people went through it, we'd throw up and we'd be disgusted. Okay, so I don't know, but all I know is this. Okay, I don't want to talk about how you fund it. I'm not interested in that. I want you to give me the top 10 things we're going to fund in our budget this year, and I think that needs to be in it.
Well,
so you figure it out. However that's what you got to fund. You take the money you got and apply it to all the things, but this needs moved up the list.
Well, there's so many things that are right there with that too.
Over healthcare. Give me 3 things that are right there with that, with healthcare. Give me 3.
Housing?
Social Security, it's not right there with that. Without your health, it doesn't matter if you have a house. And just because you can't get a house doesn't mean it's going to make you sick. You're not going to get sick because of it.
If you're homeless and living on the street,
that's homeless is a different discussion.
That's what you just said.
No, homeless is a state-focused thing because how can the federal government be responsible to just sporadically fix the problems in a few of these states that have all this crazy homeless shit? Okay, that's a state and local thing. That's not a federal. So I don't want to be. So what's your 3 things that to me that should be arguably above healthcare in getting funded?
Okay, I'm going to say maybe equally.
In defense.
I'm going to say equally.
Because without our defense, we got nothing else. So I'll give you that one.
Okay.
Okay.
Now,
maybe Social Security because we paid into it, but I think it's equal, if not more. But
the thing
there it is. So I've got 2 now. You come up with one.
The thing with Social Security is just the issue of why. I mean, all it earns is like 1.5%.
Yeah, it's not even. It's not an investment. It's just getting your money back. They're using our money and giving it back to us later, as if we couldn't have figured out how to do that at the end ourselves.
What I'd like to.
So what's one from you?
Utilities.
Same above healthcare.
Well, not above healthcare.
Yeah, no. There's
okay. If I said above, I'm sorry.
We can get a dozen things. Well, that's what I'm saying. But right now, it's not about you. Right now, this isn't even on the list. Medicaid's in there, but that's just Medicaid where half of the country dislikes the other half of the country that dislikes the other half of the country because they deserve stuff that they don't think they do. And it just, I don't. Medicaid isn't. It's just going to get tucked away because of how the country perceives it, how we see it. Okay, if this was something that all people, both sides of the aisle were in favor of everybody's freaking health. How can both sides not come together and say, look, the Medicaid will take that budget, move it over here, but we want to apply it to everybody evenly. What makes sense to how should somebody qualify for this? And then you put the Medicaid within that and make it about health, where everybody that doesn't make enough money to buy medicine and to see a doctor shouldn't suffer because they can't or they don't, for whatever reason. So if they want to be a lazy ass and sit on their ass, if they're an American citizen, in my opinion, anybody who makes less than a certain number, whether that's I can't imagine it's less than 100. 100 grand, days, no. Maybe 200 grand, whoever, that ought to be part of a bigger program that Medicaid is within. Maybe it's all Medicaid. Maybe it's just Medicaid expanded, but it's applied to anybody under a certain income level, so it's applied equally without discrimination instead of just qualifications that seem to be skewed.
Well, yes.
Maybe unfair.
And you brought up, being that person that is $1 over the 50,000 mark.
Whatever that is, I don't know.
But there's lots of programs like that especially right now for child care for people. Child care is just shot through the roof, and
that's something else our government should be, if not participating in, at least subsidizing, because I think that they could subsidize that to a profit. I think child care is a great opportunity. I mean, we need more and better child care.
That's the optimal word, better.
Yeah.
Because
but the more you have, the more competition you have, the more selection that people have, the bad ones will drop off the wayside. When you don't have selection, when you don't have enough, you're stuck with whatever you got, and a lot of times it ain't great.
True. You see so many people getting charged for.
It's so much easy to spend money from here, isn't it?
Well, absolutely.
I mean, listen, it's easy to sit here and talk about spending all this money. All I'm saying, for me, from my perspective, is I think it needs moved up in line.
I don't disagree. The sad part, it used to be we would say that. Profit is not a dirty word.
Shouldn't be.
But sadly, some industries and some companies have defined profit as an obsession of theirs, and strive
you could talk about a nonprofit company ain't any better than a profit company in a lot of circumstances.
Yes, it's all their mission statement.
So it comes back to the quality of the company. Right. And that comes back to, again, for me, the baseline is choice, selection.
Well, but see, just...
if somebody's doing a piss poor job, if your insurance company sucks, change.
Well, but you've heard, through all the news and everything, that your electric bill is going to go up another $27. I'm not happy with that.
Yeah, I don't pay any attention to it. A lot like I don't pay any attention to how much gasoline is a gallon, because I can't do anything about it.
Well, but
and I don't. I'm not saying I like it. I'm not saying I agree. I'm not saying it's not important. It is. It just seems like that's a political fight, and I think this is.
So why?
I think this healthcare is more of a moral.
We vote, so why can't we? Tell our elected officials that you tell the PUCO that they can, but we don't. When they come down to a reasonable profit margin, why do they have to be multi-billion in profit?
We can when we do,
on our backs,
but we don't, because we've allowed to. I think there's too few of those companies out there. I think some of the political administrations argued that going to a different form of power would help curb their greed. because then the other options and they'd have to get more cost competitive. Well, that's all failed. The wind and the sun and all that other bullshit is not competitive.
Yeah, but there's more and more
but
people
it's
putting
not,
solar on their roofs.
It's not competitive.
No.
So it's not enough to make these companies to make their energy more affordable. There's no reason to. We've subsidized the wrong things. Obama did, and how many billions went out of business from that green deal?
Yeah.
You know what I mean? We're experiencing the same thing again from all this solar. It's all bullshit. So we got to go to nuclear, period. Okay?
There's a company,
has to happen.
There's
starting
a company
tomorrow.
called Reliant.
Okay.
Look them up, Reliant.
But that as soon as nukes go in, that'll control our electric costs.
Well, they make
because that's bullshit.
They make a nuclear power station the size of a semi-trailer.
Yeah, I've heard about those. They're mobile, I thought.
Mobile.
Yeah, so I mean, I think that's very genius.
So
here's what's got to happen. Our country's got to be prepared for all of the adjustments for those things going in, but they need to start going in. Now, from those adjustments I'm talking about, I don't want to know. Drives me crazy. I'm dying already. I don't want to kill myself by, obsessing over things. So I try not to pay attention because I can't control it. However, I do have a pet peeve with the electric because before COVID, I would have one electric bill seasonally during the warm months and one electric bill seasonally during the cold months. And it would be a lot more during the summer. I'm running my air conditioners, all those kind of things. And it'd be significantly less during the winter. My electric bill's the same all year round. Don't matter. It doesn't matter if I have my AC on. Doesn't matter if I don't. They just decide what they bill. They're just going to bill people and don't even try to fake it. My bill doesn't. How could it be the same?
So
I'm talking the last 2+3 years since
instead of these people on the square standing with signs saying "No more Doge," who is trying to save us money, why aren't we standing up there saying, no more increases to our health care, no more increases to our electric grid, more increases to...
If the Democrats, I don't get paid a lot by the Democrats, but if the Democrats would listen to what you just said, I mean, they have a place to rebuild their party saying those kind of things, because those are who would say no to any of those?
But that's the thing.
It
used to be we could sit down as two parties and come up with the best.
Now half the country thinks half the country's wrong, and the other half of the country hates the other half of the country.
I know.
Okay, so
even
irreconcilable differences.
If we come up with a plan that is best for us, all of us, they will fight it. They
don't want that because that takes away their control and power. It all should be just all about us. And here's what is blowing up in their face. Okay, people, there are factions, small factions of people. I can't generalize anything. Okay, but nobody really cares. I don't care if you're white, black, gay, straight, a donkey. I don't care. I mean, I just really don't. I just want to be around people that I like and people that like me and that people that get along and people that can interact with each other and take each other for what they are. And not once do I alienate. No, you're black. I'm not interested in whether or not you can handle my personality. I don't care. I don't think anybody cares anymore. I think it's a boogeyman under the bed argument that just doesn't exist anymore. My kids don't even understand it. Their kids won't even have a clue what we're even talking about. It'll be like dinosaurs. Yeah. No, it will. I think they just amplify and aggravate for purposes of power and money.
Yeah.
You can't take that away from them. That's why what you said will never happen. We'll never just all come together. It'll never happen. So what right now, the reason the Democrats, my humble opinion, can't get their footing again is because the Republicans or the Trump party, frankly, I don't even necessarily think it's the Republicans. I really don't. But the Trump party is going a direction that everybody else just wants to hate. That's all they got.
No.
No, that's all they got. I mean, that's all they got. What else can they say? Don't touch our Medicaid. Okay. Hey, you know how I'd fix that argument? Whenever I came as independent, whatever, I'd say, I agree, let's fucking increase it. Yeah. What are they going to just say now?
Right. Exactly.
Okay, so that's what Trump administration ought to be saying right now. You know what? We're not. They're saying that, but we're thinking about increasing it. What would they say? Oh my God, no! You can't add white people to that. I mean, would that be their argument? I mean, it's not my perception, but what else could their argument be?
They would
Right?
come up with something.
Yeah, some kind of angle like that, right?
I know, and that's where, yes, there needs to be much more, even though, just like with Doge, and all the billions and billions that we're saving, cutbacks, it's like anything in a household. When you find that, the credit card, statement is maxed, on all your cards, that you've tapped into your 401k, and everything is late. What are you going to do? You have to cut. And sometimes, having the boat and having the, timeshare in Vegas and having, lavish trips a year, just because you feel that that's what you deserve.
Nobody can disagree with you. I mean,
but the Democrats do.
Well,
the people on the square
they
do.
disagree with anything that
Well,
Trump
sadly,
is for.
Again,
period.
Sadly, again, these people, I don't know where they're coming from.
They're elitist. They live in an echo chamber. I know I'm repeating myself, but the reality is that's all they know. I mean, listen, let's both be candid about this. The fact is, what I'm saying has to be true. It has to be that they live in an echo chamber and they work on these universities and they're elitists and they only listen to the type of news they want to listen to, and they don't open themselves up.
But they can say the same thing about
but listen,
us.
it has. You let me finish my point. This is a dart right in the center here. If you think about it after I say it, okay, it's all of these people have to be secluded to that echo chamber. The alternative would be that they're fucking stupid. No.
Okay.
Pick a boat, whichever boat you want to get on. I prefer to pick the boat. They just live in an echo chamber and they don't open themselves up to the realities of the world. So based on what they're intaking, a reasonable person may only be able to come from there. So I just give them the benefit of the doubt. Otherwise, they're stupid.
They're the same people who back in the 1700s, she's a witch.
I mean, you can make comparisons, but I just think it's what they choose, and honestly, it's very ironic to me, my belief, because I think that their need, their greed, their sense of power and control over money, their well-being, okay, those kind of things that motivate them, these elitists, are the ones that are ironically choosing capitalism and the ability to have all that money and have all that power and control. But they're choosing that, but they don't want capitalist society. They're against anything capitalist. So they only want to hear what they want to hear that's going to benefit them and keep their college or university going and make sure that they're hundreds of thousands of dollars a year and all their benefits, and they don't have to work summers, and it's greed. So they don't want to know. I don't want to know.
I agree with you.
Okay, so
now,
that's who they are.
But now, I think I've heard this number, but what do you think the percentage of Democratic or left-leaning
you mean
people,
Democrat?
Democrat
or left-leaning.
Yes, Democrat or left-leaning workers are in D.C.? What percentage of the workers, the people that work for
Period. Just period. Like not you don't. When you use the word workers, you don't
For the
mean laborers.
government.
You
Yeah,
mean just
for the government.
employed people. 98.
Oh, okay. I was going to say 80%.
It's well into the 90s.
So then,
If they're there and not a Democrat or left leaning, they were born there and haven't had a chance to get out yet. Okay? The people who are there are choose to be there.
well,
Until you get into the bad neighborhoods, which is another argument.
I guess
DC
what I'm saying
and Baltimore.
is working.
Employed people are there because they choose to be.
So that's where it's hard to break the cycle of what we're in.
No, you do. There are ways of doing that, and I think we're actually, if we're not doing it, we talked about doing it, and that's take these entities like Department of Agriculture and move it to Wyoming, and start moving all these administrations out of D.C.
Yeah.
Get them out of D.C. and put the administrations in the state that best reflects what that particular administration is supposed to be working on.
Right. Agriculture.
Get them out.
Yeah.
All of them. Put them somewhere. Mm-hmm. Put the Department of Education, if you're going to have one, put their offices in the worst part of Chicago that exists.
But that's still a Democratic stronghold.
Put that, I don't care. Put the people that have to run that administration in Chicago. It wouldn't stay Chicago like it is very long.
Honestly, I would probably they would fund more money there.
Well, I'm just telling you, they wouldn't go to work. They wouldn't go to work every day in a shithole. You're missing the point.
They're in D.C. now. What do you think the quality of education is in D.C.?
No, forget the education. The people that choose to work there probably weren't educated there.
They would just
so talk about the education.
Elite, city to another.
Yeah, there's good and bad neighborhoods in D.C.
Put it in.
There's good and bad neighborhoods in D.C. You can't
put it in Jacksonville, Florida.
Listen, I'm in favor of all of it getting out of D.C. D.C. has become a lobbyist city. That's all it really is.
Exactly.
Okay, so just get rid of it. Get them all out of that core. Get them all out. And I thought we were in the process of doing that. I mean, if we're not, I'll be disappointed.
Something more important in our podcast?
Mm-hmm.
Okay.
Yes, it was my throat.
No, okay. I thought your beep.
Oh, no, I didn't look. I've got something else up.
So
we haven't accomplished anything today other than I'm still going to hold hardcore to my belief that health care should be moved up in the importance of our budget.
Well, I feel
I know you have a different budget. I mean, in administration.
But I feel maybe differently than you.
Well,
that on the issue of what I hope out of this podcast, I want to be provocative enough to have people think independently and come up with, if we have any kind of Democrats or anybody that leans to the left, and I don't mind.
I don't care who you are. This podcast, anytime, ever, period. Right. But especially with this, I certainly invite everybody's ideas. I'm not saying I have the idea, but I mean, there's got to be somebody smarter than me that can come up with an idea.
Share this with somebody in an echo chamber.
Yeah, everybody has health struggles, man.
Exactly.
Everybody has health struggles. So, I mean, I don't understand how it has anything to do with where you fall, left, right, or otherwise.
It shouldn't.
I just don't.
It shouldn't.
And if anybody, whether they're a representative in D.C. and Congress and the Senate, if anybody says, they're just lying. You know what I mean? It shouldn't have anything to do with your political beliefs.
Right, exactly.
So just take that element out of it and put it across the board. And if you do that across the board to people, it's deserving. and just justify it, and that will encompass the people that are getting it right now anyway. So you're not going to take one off, and you're going to add more. So you're going to add more votes. How are you going to criticize that bill? How? No. Are you? I mean, their only criticism could be. I mean, logically, their only criticism could be the white people don't deserve that.
Well,
because that's probably the majority of who would benefit from that expansion.
So now let me ask you, what do you equate Medicare to? Because you said everybody,
Medicare is completely different than Medicaid.
Right.
It's completely not even.
I know. What do you say? That person at whatever level, 100, 200,000 or below, should get that automatically?
What? I think Medicare is more of an age-based.
But you said earlier that you would like to see that expanded to where people just
Medicare? No.
Okay, did I say Medicaid? Okay, Medicare. I get the two.
Yeah, no, and it's very important. People, I think our whole country does that a lot. I think that's common. I don't think until somebody's affected by it, they know the difference between Medicare and Medicaid.
So
Medicare is an
okay.
age-earned benefit.
So you want Medicare to be just available to people under a certain income level?
No. Medicare, I just said. Medicare is an age-earned benefit.
Well, then what was the
Medicare is part of retirement.
Okay, but
Medicaid is what we pay, what we used to, in our generation, knew as welfare.
Okay.
That's Medicaid.
Okay, so
that
which one do you want the
that should
100,000, 200,000?
To Medicaid. I think everybody who makes less than $100,000 a year, the government should provide health care to. And if you're not getting the best surgeon, sorry, but you got something. I think it should be an income-based benefit. I don't think it should be based on how many kids you have. I don't think it should. I think it should just be an income-based for health care.
Okay.
I'm not talking about SNAP money and food and all that crap part of Medicaid. I'm talking about the health provision, the care sources, the different things of just the health.
And of those people making $100,000 a year or $200,000 a year, they pay nothing into the system.
I don't know how. You've asked me that earlier in the thing, and I'm not smart enough to tell you how this is funded. I'm telling you, don't give a fuck how it's funded. Stop arguing against something that logically is for the benefit of the American citizen. Stop using the money part as an argument against it and argue against whether or not you think people deserve it.
Listen.
Then you can figure out how to fund it.
I just saw this, and I'm thinking, why then?
Make me a sign, I'll carry that on the
Why then
square.
didn't the Affordable Care Act work?
I don't know enough about it to give you a legitimate response. I don't think it had anything to do with here is a health care right that nobody's going to judge or qualify you for. It had to do with how much money you made and how many people in your household and where you live. And I mean, it wasn't free. You still had to pay for it.
Right.
I said free.
I understand.
So don't compare apples to oranges. Free. And stop selecting. Stop picking. There's no administrative people needed to decide whether you qualify. If your fucking taxes were less than $100,000 last year, next year you get free health care. Period. Okay. And every year your doesn't take a building full of administrators to see if you qualify and fill out this 10-page form. If your taxes were less than $100,000, here's your Medicaid card. That way it doesn't matter skin color, race, creed, age, nothing, doesn't matter. Old guy, young kid, doesn't matter. If you made less than $100,000, it's free. I think it needs to be made a right for American citizens. And I don't want, again, for the third time, you ask me how the fuck they're going to pay for it. And whether those people have to pay for it. I think they need to be an American citizen. I think when you start talking about requiring somebody to pay into it, then you start the race wars. Because these people, these these people who don't have any income at all, can't participate in that. So now you're taking health care away from them because they can't. Just make it simple. Everybody. Doesn't matter how old you are, doesn't matter what color you are, doesn't matter if you're male or female, doesn't matter. If you make less than $100,000, you get a free Medicaid card the next year. Now, the motivation to get those people off of that Medicaid card, it's an annual card reviewed annually, is you don't get to pick your surgeon. You don't get to pick the best cancer doctor. Okay? You're just getting the government basics, so you're getting health care. Period. That's what it is. And the motivation is to get off of that to make more money so that you can buy your own doctor.
Right now in the healthcare system, you can have the top paid surgeon work at the same hospital as the person who graduated, 125th in his class. So
depends on where they work.
Your chance
and where they work, whether they're under contract or not, and they can make more money than the other person. That's true. But what I'm saying, what I'm saying is that the Medicaid program that the government's going to provide isn't going to go out there and pay extra high premiums to extra high surgeons. We're going to go after our card's going to cut. There's going to be qualified people that charge a qualified or a metered expense. So you're not going to get the best of the best with that Medicaid card.
Well,
okay,
it's
because the government will be more selective.
But what I'm trying to say with that is, so now you're getting into a situation where, this doctor who doesn't earn that much and isn't that good a doctor, wink, wink. Because the healthcare. Now wait a minute, let me talk. The situation of whether a doctor is better than another doctor, they don't want to say that because then
nobody's going to say it. This is the company.
But that you just
this is the company that it's not about how good they are, it's how much they charge. Let's say let's say Dr. Cush decided to donate his money and his time to work for a company that works for the government that he only charges $150 an hour for. Maybe he chooses to do that. Otherwise, it's going to be the kids who are just starting out in their profession, and they're starting out maybe in their first job as a doctor, so they go to work for the government, just like they go to work for the public defender to learn how to be a prosecutor. It's kind of a step up where you've got that socialist base to cover the in need, and then you still keep the capitalists for the rest of the people who can afford more. And if you're not motivated enough to make more to be able to buy a better doctor, that's on you. We're giving you the health care that you deserve, or that I think that you have a right to by being an American citizen. That's just me. Abe Lincoln also said that slavery should stop. People probably thought he was crazy.
You didn't want this to be a class thing.
However, I want it out of the classes.
However, you are just creating that.
No, I'm eliminating it.
No, you're
anybody who makes less than $100,000, despite of
you
their
want somebody to go to a bad doctor.
Now, okay, you'd be a great politician because it's not what the fuck I said, but that's a good twist the words and make it into that. Okay, what insurance you choose to get will dictate how good your doctor is right now. I don't give a fuck who you pick. You can have, I only want covered up to this amount, or I only want covered up to that amount, or I only want covered. The insurance company that you select is going to give you better opportunities with better quality doctors than others. Period. Same with auto insurance. You can buy cheap-ass auto insurance. Okay, so there you go.
Now
so
yes.
It's the exact same thing. You can parse it however you want. The fact is, whether or not the government participates in making sure everybody does get something or not, the rest of the country is still under that control of which better doctor you get or don't. You're not going to get to a doctor that's just starting out if you've got a rare heart disease. just not going to be how it works. Okay, so the bottom line is it's no different than the country is now. It's just we're going to expand the coverage and we're going to regulate it a little bit better. And if the doctor wants to work for that government entity that we're providing health care for, then they have to be within this payroll scale.
You are 100% in a socialist.
Yeah, I learned off of Bruce. That's exactly what I'm saying. There's got to be, with health care, nothing else, man. With health care, there's got to be something. I don't want that to be right, but tell me what's better.
But the bad part of any of this is we have become a society where health care used to be kind of low because we had good food, nutrition-wise. We were
I know.
Healthy.
We're getting into a whole new argument about which I want to have a different day, but we can't get into that. But you're right. I mean, if we would spend more effort and time on preventative and what we eat and getting the dyes out of the foods, I think like we're starting to do right now, I think that will come around. I mean, I think it's probably another maybe a generation or two before that starts to take effect. But you're right. But we can't continue blaming that as the problem and not actually covering people that deserve health care. Maybe it would help your homelessness ancillarily as well, because a lot of people that don't get health care right now could get diagnosed.
Well,
mentally ill, or maybe get on meds, or they get, I think it wouldn't hurt. I don't think it'd solve the problem, but I think it would be help.
And on that issue, just this morning I heard a newscast that was saying that I believe, and sorry if I get the state wrong, I believe it was Iowa or Idaho, an I state, that there are families who are turning their teenage kids over to the state because they can no longer take care of them due to mental health issues.
Uh-huh. Yeah.
So,
well, that might be a generation we're raising, but on that note.
Yeah. Are we ready to wrap it up?
Yes.
Okay. So, what notes do we want people to look at?
I just like somebody to solve the problems of the United States of America, at least with regard to the health challenges, health insurance challenges, and give us some ideas. I mean, I like to know what's so bad about mine. I'm not accused of being a lefty very often, okay, but I'm saying that genuine after living, a long time and experiencing the ups and the downs of this country, I just think it's something that's not taken seriously, and I think it should be at the top of the list. I don't think it's a constitutional right. I think it's a citizen's right. I think it's, it's what else?
Humanitarian issue.
Yeah,
I understand.
I just think we deserve it. God damn it, I don't want to be felt sorry for it, because the humanitarian argument is that's what we're doing right now. It's a welfare program, humanitarian. Okay, get rid of that. Don't let them out. Keep them in, but let's expand that. Let's not just isolate it to people we want to be critical of, and cut a line across the board that American citizens who make less than $100,000 a year, that's humanitarian to me.
Well,
I mean, what else do you want them to not have? You know what I'm saying?
I get it.
I think it's human. I think the argument, I don't know what that number is. Maybe greater than 100.
And one thing I didn't research was, the percentage of people who are in healthcare debt.
It's nuts. I'm probably one of them. I'm sure there's debt out there for healthcare that I've had.
Cancer issues and so on and so forth. So
listen, we've had some subscribers. We can't get any comments from anybody. So we see you looking, we see you watching. Comment. Let us know where you are.
Let him know that he's wrong.
Even if it's critical, give us something. We'd appreciate it.
All right.
Peace. Next week.
Have a good one. Oh, subscribe. Yes, subscribe, share, and comment. All of the above.
I thought we just covered that. Peace.